So thanks for joining, and let's go ahead and get started. But this is really important, guys, that we're going to have a discussion about this. If you guys were thinking you were going to come on this call and I was going to tell you which is better, a Med Sup or a Med Advantage, you would be mistaken. I am not going to do that. I don't even suggest you do that with clients. I was talking to an agent this morning. She's like, well, I just want to sell Med Advantage. I'm like, okay, well, that's up to you. But I'm of the belief that we should be educated. We should be able to compare and contrast. We should be able to discuss with our clients in an intelligent way the differences and similarities. And then we really should leave it up to the client to say which path they like. We're not going to get into really a lot of stacking here today, but I do want to reiterate that I am going to be talking about some concepts that really require you guys to really think about stacking, especially when it comes to Medicare Advantage plans. I will just tell you, many of you, who I will not point fingers at, have done a phenomenal job of stacking health plans with every kind of sale imaginable except Medicare Advantage. So we got work to do, guys. We're leaving our clients exposed. Okay, so if you don't mind, there are some really terrific, experienced veteran agents on this call, but so I'm not going to do a Medicare basics. I think that would insult your guys' intelligence. However, I want to go through some topic or material here, and I'm going to use the Medicare and You book. Let me tell you first why. Believe it or not, almost all of my Medicare presentations uses the Medicare and You book. I do not create any of my own consumer content. I use the Medicare and You book, first of all, because it is by the government and I know it's compliant. Second reason is because they're going to get this anyway. It should be sitting on their coffee table. The third is I actually think it does a pretty good job of confirming the kinds of things that we say. So it's not just some agent telling customers this, but it is right out of the government's handbook. As you can see, the handbook is 128 pages. I think the government has done the Medicare beneficiary a disservice by sending them a 128-page book and say, go figure it out. That's why we have a job. So that's what we're going to go through. I'm going to start on page 9, and I'm going to go through a couple of pages, and then, guys, this isn't a presentation, this is a discussion, so please be prepared to unmute. And if you don't, I'll call you out and I'll ask you to unmute because I'm interested in hearing your guys' feedback. So as you guys know, the basics of Medicare is that when somebody becomes eligible, they need to enroll in Medicare Part A, which is hospital, Medicare Part B, which is doctor, and Medicare Part D, which we all know are drugs. And in a minute, we'll talk about C, if you're wondering why we skipped C. Always keep in mind that enrolling in Medicare is mandatory. Failure to do so without having some sort of exception from doing so results in a penalty, and that penalty will be assessed for the rest of your life and you can't get out for each month that you were eligible and chose not to enroll. And by the way, ignorance of that rule is not an acceptable excuse. I've had clients tell me, I meet them when they're 70, they just said, I decided not to enroll. Well, I said, did you know there was a penalty? No. Can I get out of it? No. Well, I didn't know. It doesn't matter if you didn't know. You have to enroll, unless you have some qualifying situation that doesn't require it, but most people are required. Failure to do so results in a penalty. Okay, but this is really where I wanted to spend just a couple minutes. So, as you guys know, there are 2 ways of going about getting your Medicare, and don't let the consumer get all confused. Sometimes they think that there's only one way because they see TV commercials. Sometimes they think that they have numerous ways. I just saw a report today that Congress is kicking around providing even more than 2 options. but right now there are two. First option is you stick with original Medicare, A and B, you add a D, a Med Sup, and other ancillary products. Your other option, and you can never do both, is a Medicare Advantage plan. That's where you have your A, your B, your D, extra benefits, and your doctors and hospitals all in one. Okay. There are pros and cons to each of these, and believe it or not, Medicare actually goes through them. So on the left side is original Medicare. It doesn't talk a lot about the supplements, but you'll get the idea here. And then on the right side is Advantage. So with original Medicare, you can use any willing provider. With Medicare Advantage, you got to stay in the network. Certainly there are PPOs out there, but if you don't stay in the network, it's going to cost you a lot more. With original Medicare, you don't need a referral. For Medicare Advantage, you will. Now, let me just tell you, the Medicare Advantage plan, let's just understand, guys, that there's a reason why Advantage plans are saving the government money. There's a reason. There's a couple of big ones. One is that Advantage plans cover preventive. So the long-term outcomes have been better than when it doesn't cover preventive. But there's two bigger reasons than that. Nobody likes to talk about it, but it's true. But it's the cost containment features of an Advantage plan. And the two biggest are referrals and prior authorizations. So what's the big deal about getting a referral? So let me just say this. Getting a referral is not that tough if you're healthy, right? If you're healthy and you say to your primary care physician, I want to go see a foot doctor, not exactly that hard to get a referral to go see your foot doctor. So it's not that big a deal. Where referrals start to get to be more of a cost containment type of tool is when you're trying to go see different types of specialists because you now have a health problem. And over, I'm going to focus on cancer as the health problem as we go through this. Obviously, there's way more health issues than cancer, but I think it just kind of helps the discussion if we focus on cancer. So you need a referral to go see a specialist. I always tell clients, if you're healthy, getting a referral for a specialist ain't that tough. Only when you start having something big can it get more challenging. And they may say, yeah, I'm not going to approve that referral. Or if you just have somebody who just wants to go see a specialist just because they're bored. Okay, let's continue. So then with original Medicare, again, I don't know if you guys, let me make this bigger. Is that better? So with original Medicare, obviously for Part B services, there's a 20% coinsurance. That's where your Med Sup picks it up. With your Advantage plan, you have out-of-pocket costs, usually with copays and a max out-of-pocket. The premiums, obviously, on a Med Sup are going to be significantly more. Most Advantage plans have zero premiums, whereas a supplement, what I typically do when I'm talking to a client about a supplement plan, I'll ballpark it. I'm like, okay, Mrs. Jones, you just turned 65. So for you, you're going to pay whatever, about $125 a month for your supplement, another 40 for your drug plan, another 70 for various ancillary, including dental and cancer, and then you're going to pay another 70 for a extended care. So when you add all that up, it's about whatever that is, about $350. And I start with that number. And I can't emphasize enough how much I encourage you guys to start off with a number like 350. Let me tell you why. Because if people are turning 65, it's most likely that they're coming off of individual coverage or group coverage. And it's not uncommon that they're paying $700, $1,000, $1,500 a month on their health insurance. So when you come in at 350, you sound like a hero. They're like, wow, 350, that's great. Mistake agents make is they start out talking about the med sup. Okay, Mrs. Jones, I can get you a med sup plan N for $125. Now you've just put into the brain of the client $125. And then you start adding all this other stuff, and now you end up back at $350, and now they're feeling like they got rigged. Start at $350. I didn't even explain to the client what made up the $350. I just said, this is the price point that you need to think about. What would you do if she said, well, $350 seems like a lot. I can only really do $300. Sure. No problem. We can customize this thing. We can get it down to $300. No problem. I'm just giving you $350 to kind of get a start. I've never, ever had anybody balk at that. Nobody has ever told me, I thought this thing was going to be cheaper. Never. Okay. On a Medicare Advantage plan, I encourage you to do the same thing, but obviously your price point is going to be a little different. I would say, well, Medicare Advantage plans usually have no premium, but then by the time we might add a cancer plan, a extended care plan, and a dental plan that provides you more benefits than what this one does, that's going to run you $125. Does that fit? If you start at zero, that is the biggest mistake agents make. They start at zero, and then they wonder why they can't stack on top of a Medicare Advantage plan. It is so hard to move from zero. And if you start at zero, I'm just telling you, you're just making your life so much harder. If they say, well, hey, I saw on TV that these plans are zero. Yeah, they are. But that's just for the Advantage plan. There are holes in it. The way I like to think of it is with a Medicare supplement approach, you are providing a customer with a more predictable outcome in terms of their health plan because they're going to pay that premium every month, and their out-of-pocket costs really just come into copays for the drug plan and the Part B deductible. On an Advantage plan, you got copays on those. And so what you're going to spend each year is a little more unknown. Oh, I'm sorry, I forgot to mention hospital indemnity plan. I know Billy would kill me. I forgot to mention hospital indemnity plan because Billy, who's on here, he's probably our best Medicare Advantage producer that stacks a hospital indemnity plan on almost every sale. And correct me if I'm wrong, Billy, you like the Wellaby hospital indemnity plan. Can you talk real quickly about what you do about cancer with those Wellaby plans?
Yeah, with the Wellaby plans, you have the ability to offer up to $10,000 of cancer coverage. So when we're quoting the Wellaby, we include that automatically. We explain the benefits of the HIP plan, and we add the cancer plan. So it's not a question as if, do you want a cancer plan? It's here is the package, the protection package that we offer to go along with your Medicare Advantage plan. The HIP plan is going to help cover some of those out-of-pocket costs that you're going to have with your Advantage plan, and the cancer plan is going to give you $10,000 of coverage if you were to come down with some sort of melanoma or internal cancer. It's just part of it. It's automatically included in our book.
So how much do you think it would add? So if the hospital indemnity plan without it is, I'll just say $50, how much does that $10,000 in cancer add to it?
About 22.
About $22. So for whatever it is, $50-$60, Billy is doing a better job of protecting his client than the agent who's leaving their client exposed to the out-of-pocket costs and the risk of cancer. And for $20, you can't sell a standalone cancer plan. You're just putting it in there as your package of protection. And I'm telling you, the way Billy's describing it is the right way to do it. Look, this is our package of protection. You notice he didn't say it's going to be free. That's the mistake agents make. They start at zero and they wonder why they can't get off. If you're at zero, it's almost impossible to get off. Billy doesn't go around saying, hey, I have a zero premium plan, and then try to come back in there and say, oh, by the way, you're also going to want to pay the $60. It's a package of protection.
Andy, one more thing I might add about the Willoughby. They have guaranteed issue from 64 to age 79, I think it is now.
Yeah,
They've upped
they
it.
just
So
increased it. Yeah.
So there's no reason for your client to not get and be approved for a HIP plan. And if they do have a pre-existing, after 6 months, it will cover that claim if they did have it. So Willoughby is our go-to.
Love it. Yeah, I love that product. They do a great job with it. They've got really great tools too. Maybe some of the better ones out there. If you don't have Wellaby, I highly recommend you get it. And I am tickled to death to say that Wellaby is going to be one of our key sponsors for our agent conference coming up. They were the first sponsor that signed up and picked the VIP level. So looking forward to seeing Kelly and company here this summer. Thank you, Billy. Continuing.
Is Willoughby nationwide?
Close, but not all states. No.
I'm
I
not
can get you a
familiar with
product
them in
availability.
Georgia.
Say again.
I'm not familiar with them in Georgia.
Oh no, they're in Georgia. It's the old Medico.
Oh, okay.
Yeah, I'm sorry, I should have mentioned that. So Medico changed their name, I don't know, Billy, maybe a year and a half ago, 2 years ago,
Yeah,
to something like that, to Wellaby. But it's the same old Medico that we've been selling for years and years and years. But if you don't have Medico or Wellaby, which are one and the same, you need to grab that. And I can't emphasize enough, you've got to present it as a package of protection like Billy does it. If you start offering zero premium plans, you're going to be stuck with zero, and then you're going to wonder why your client's exposed to things like out-of-pocket costs and cancer. All right, continuing. No yearly, where were we? Premiums. Okay. On a Medigap, obviously this is a little backward. It says there's no yearly limit, and that's only because if you don't have a Medicare supplement, you're exposed massively. So nobody should ever have original Medicare without having a Medicare supplement plan. So that's a little not appropriate. Of course, all Medicare Advantage plans have a max out of pocket. They're stated and they're upfront, so you'll know exactly under worst case scenario exactly what the out of pocket costs are. But always keep in mind, you got to stay in the network. If you go out of the network, if you have a PPO plan, your out of pocket max is usually higher and sometimes significantly higher. Well, obviously, you can buy a Medigap on original Medicare. You cannot have a Medigap. That's where you got to do the hospital indemnity. Again, we're not going to go through a basic training. I just want to make sure that we're level setting. Then, in terms of coverage, original Medicare is going to cover doctors and hospitals and things like that, but it doesn't cover things like dental, vision, and hearing. Medicare Advantage plans cover the same sort of things, but oftentimes do have extras. One of the things, guys, I think we should be prepared for is the days of all of these extras being thrown in, I think will start to decline. And I think we already have seen it this past selling season, but we're going to see it even more this next selling season. CMS is cutting reimbursements back. Carriers are getting killed on this stuff, and you're going to see them dial back some of the nice freebies they've been throwing into Medicare Advantage plans. So be extra careful to look to see the changes for when they become available. Usually first looks show up around June-ish, July-ish. Keep an eye on the extras. I think you're going to find they're going to be a lot different. But all the more reason to make sure that we're not assuming that their Advantage plan is going to cover things like dental and vision and hearing. Of course, if you're doing original Medicare, you need a separate drug plan, whereas all Medicare Advantage plans, unless you exclude them, cover Part D. And this is one, by the way, that I oftentimes will use with clients when they're trying to decide which path to take, is I say that Medicare Advantage plans don't travel that great. If you're going outside the country, as you can see here, plans don't cover medical care outside the US. Now, we do have international travel insurance, so they can add that, but it's pretty pricey. Whereas with a Medicare supplement, it has at least some foreign travel benefit. especially for emergencies. So if you have somebody who travels a lot, I tend to focus more on the supplement side. I also, and I'll let you guys chime in here if you feel differently. I find snowbirds tend to go more on the supplement side than the advantage side. Because if they're spending 6 months in Michigan and 6 months in Florida, it makes trying to stay in the network more challenging on an advantage plan. Doesn't mean it can't be done, just more challenging. Whereas with a med sup, you can spend 6 months here, 6 months there, you can go wherever you want to go, and you don't have to worry so much about the network. Okay, I think that's a pretty good, we're not going to go through too many more details, so let me just leave this up here so that way you guys. So let's have a discussion. Again, I don't want to get into which one's better. That's just throwing a fireball into a room. But what I would like to talk about is what are some circumstances that you guys see where Medicare Advantage is more appropriate? What are some circumstances where you like a Medicare supplement approach? I'm sure there's some people on here who say I will never sell an Advantage plan. There'll be some that say I only sell Advantage plans. Again, I don't know that we need to get into all that. And I'll kind of get things started, but if you guys could unmute your line or type into the chat box. So let's start with, as I've mentioned, travel. That's always something I bring up with people. If they're planning on traveling a lot, I always make sure to bring up that point that there are some limitations on how Advantage plans will pay, especially if you're traveling out of the country, but even if you're just a snowbird. I tend to go on the supplement side. By the way, one of the things I think is a misunderstanding is that rich people buy Medicare supplement, poor people buy Medicare Advantage, and that just is not true. There is a massive consistency between Advantage and supplement plans with the demographic of the consumer. However, I will say this, where there is clearly a statistical difference is urban versus rural. Now, in some states, so like Billy, I'll throw him back under the bus. He's in rural Tennessee, but Tennessee has a fantastic Medicare Advantage market in the whole state. I'll throw myself under the bus next here in Texas. If you're in Dallas, Fort Worth, this is a Medicare Advantage market and they dominate here. But if you're in Wichita Falls, take a look at the Medicare Advantage plans in Wichita Falls. They're not very good. And let me tell you why. Because if you go to some of these small rural towns, there may only be a handful of certain types of specialists. And Medicare Advantage plans must meet network requirements of a certain number of specialists. Well, the specialists all go have breakfast together and like, yeah, let's not work with this company. They don't have to. So now all of a sudden, the Advantage plans don't have access to a couple of guys that that do that specialty. And that happens a lot. Could also happen with hospitals where a hospital just says, yep, we're only going to work with this insurance company. We're not going to work with these others. Somebody was posting it in our Facebook group that some hospitals, especially those rural ones, have said, we're not going to do Medicare Advantage at all. So there are some rural markets where Advantage just isn't an option. There are very few urban markets where Advantage is not a dominant player. And there's certainly some states where it's not. But for the most part, urban, heavy Medicare Advantage, rural tend to be heavier on the sub. Other thoughts? I'm just stalling until somebody wants to jump in and share their thoughts.
Yeah, Andy, I'll add something. So maybe not many people on the call know the name Victor Kayam. So Victor Kayam used to do commercials. He said, I like the company so much I bought it. And that was Gillette. So I sometimes think of myself as Victor Kayam because I'm an Aetna Medicare beneficiary or Advantage Plan beneficiary.
Yeah.
You mentioned referrals. There aren't any referrals.
Huh?
I think with the HMOs here, and I don't do really any HMOs except for a DSNP maybe, the HMOs don't require referrals, certainly not for Aetna, not for Humana. So referrals aren't an issue.
Okay.
I
Nice.
was with a gentleman a few days ago, and he said, Bob, I trust you. What should I do? I said, Gus, I appreciate you trusting me. And so if you trust me, I want you to listen. So, I shared with him, and his big issue was Ozempic.
Yeah.
Finding Ozempic covered by these insurance companies is a challenge. And the cost is he's actually calling right now. The cost is a challenge.
Yeah.
But, and when I'm making a presentation, one, because I'm a Aetna client, and I like the Advantage Plan, I'm at a crossroads because in some cases, if somebody is diabetic, and certainly if they're using durable medical equipment, I shy away from the Advantage Plan. That to me is an issue going forward, and I certainly make it clear to people that they have a guaranteed period to get a Medicare plan now, but 4 years from now, they might not be able to get it when they need it. I want to make that very clear to folks. You mentioned travel. I'll say Aetna. Aetna has a $250,000 overseas benefit.
Wow.
That's not bad. Right?
Oh.
Humana's 50,000. I'm not sure what Medigap does, but each of our markets are different, of course.
Absolutely.
But I know for me, and again, I don't know if it's in other markets, having a $600 fitness benefit that I get from Aetna, reimbursement, I can go out and buy a kayak if I want. Things that are going to keep me healthy. And I get feedback from clients, how much they've spent and how much Aetna has approved and sent them checks. So you're right. I'm afraid next year, I can't possibly see that continuing.
Yeah.
So that'll be an issue. But, I'll stop on this, Andy. I have the Medicare and You book, but I tell you, I don't really use it in the presentation, which I'm going to continue, which I'm going to start doing, because the way you just framed it was perfect. You start the conversation, you can talk to them about something, but here's a book they probably have using it as a doorstop at home.
Right.
Because most people said, "Oh, I don't think I got it." Well, go home and tell me if you got it. And I get calls. Oh yeah, it's there. I got to dust it off.
Yeah.
So we all get
Yeah,
it.
I've done that for years, Bob. I even have a copy of it on my phone. So like I can literally have a conversation instantaneously. I don't have to pull up any PowerPoint. I don't have to pull out any brochures. Maybe you guys have brochures. I don't know where to really find it. Carriers all got their stuff, but the problem with using a carrier is now you've got in the client's head that you're pitching that. No matter how much you say, this is just an example, and I'm an independent, they still have in their head that you're pitching them Humana, United, whatever. So I've always used this book. I've always gotten good results, and you're exactly right. They will say, "Oh yeah, I got it," but I didn't know even where to start with it. It's really overwhelming, intimidating. Yeah.
So
Good stuff.
One last thing, Andy. So
Yes,
this client that I met with a few days ago. So we did the Aetna plan, and like Billy uses Wellaby, I like the Aetna Hospital Indemnity Flex.
Love it.
And I like the Manhattan Life Cancer Plan.
Yeah.
Those three things I like a lot, and promote those. So that's my story, and I'm sticking to it.
Yeah, Bob, I'm glad that Billy likes Wellaby. I'm glad that you like Aetna and Manhattan. I love them all. I guess really what I was trying to get at is agents are making a mistake if they're just running around enrolling people in zero premium plans. We have to be providing a complete package. If they choose to lower the cost, that's fine. But we're making a mistake if all we're doing is transactional enrolling in a zero premium plan and assuming, hey, you're good, we'll just leave it at that. One of the things I think that this is an agent issue, not a consumer one. And I will take this to my grave. Agents think consumers want the cheapest, and they are wrong. Every single survey over and over and over again, seniors will tell you they want the best possible benefits that they can afford. Never have they ever said, I just want whatever the cheapest is. Never.
So that, Andy, there's a concept. Everybody knows, people know the price of everything, but the cost of nothing. And it's said a number of different ways, but you know, I want, you know, it's like you have a pencil. Boy, it's very inexpensive. Here's a pencil. But if you lose the pencil, the cost is very high. So everybody's focused on price. What our job is to help them understand the cost.
There you go. Love it. Hey, Lynette, I'm sorry I muted you a couple times. There's just a little bit of background noise. Please feel free to unmute. Billy, your thoughts?
Yeah, I was going to say here in Tennessee, 54% of the people in Tennessee that are Medicare eligible have a Medicare Advantage plan, and 46% have MedSup. So, you know, pretty much half and half. Now,
Yep.
3 years ago, the numbers were just exactly opposite. So as the benefits of the Advantage plans have becoming more beneficial, more people are moving to the Advantage plans. We typically here in our county write the Blue Cross plan. And for traveling within the United States, there's 46 states in America that has the Blue Cross plan or Blue Advantage network. So if you're in Tennessee and you go to Texas and you need to see a doctor, if that doctor accepts the Blue Advantage, then you are considered in network just like you were if you were in Tennessee. So that's a strong selling point for us. We don't really talk about traveling out of the country unless they specifically bring it up. We might touch on it, but we don't really hit on it like you do, and probably we ought to cover that a little bit more. But we do if it comes up. And the way that we do our presentation is you have two options. You've got option A, which is your Medicare supplement, your drug plan, your dental, vision, and hearing, and your home health care. And then you've got option 2, which is your Medicare Advantage plan and your hospital indemnity plan with cancer. And we are now starting to include a home health care plan in that presentation as well. So we just give them 2 options, A or B, 1 or 2, and let them decide. And like Bob, people will say, well, Billy, you know, what should we do? Which one is the best? And I can just clearly say, you know, half the people in Tennessee like one and the other half like the other. It doesn't matter to me. I want you to have the one that you're most comfortable with. And if I have to come down and make a decision, then I'm going to think about their finances. I'm going to think about their health. I'm going to think about how convenient one is over the other, and I'll point them in that direction. But at the end of the day, I really try and make them make that choice. And I make it simple by just giving them 2 options that are pretty similarly covered with different prices.
Gosh, Billy, that's the best summary. We should probably just hang up this call because that's really what all I was really trying to accomplish with this entire discussion. That was perfect. Thank you so much for chipping that in. And I can't emphasize enough. You notice that Billy is going at it with those packages right from the get-go. You never heard him say, hey, let's just go with the cheapo one or the zero. They're both good. Neither is better than the other. It's really a question of how you like to get your health care. And as long as you're stacking them both, you're going to get a great experience with either approach, and let the customer choose. I love it. By the way, real quick funny story. Billy takes me out to lunch in his town, and I'm not joking. I'm sorry if I've told the story already. Our waiter was 5 years old. The cutest kid you have ever seen, but he's literally 5 years old. Never had a 5-year-old waiter before.
And he got our orders right too.
And he sure did. The only bad thing, by the way, about a 5-year-old waiter, I will have to say, is that when he brought me my iced tea, his fingers were in it. But, you know, that's all right. I still drank it. They had a little extra dirt in there, but that's okay. I filtered it. That was fun. Okay, sorry, I got off track. All right, who's next? Rodney, good seeing you, sir. How are you? You're muted. Let me unmute you. Oh, you got to unmute yourself. Well, he's figuring that out. Wanda, you want to jump in here? I can't believe Sharon Luker has not voiced her opinion on this subject.
Hey,
Am I lying?
I put it in the chat.
Oh, did you?
That's what I did.
Okay. Okay. So,
Okay, I'll jump in, Andy, since you're harassing. So if I'm talking to someone and they've got a lot of medical issues, or the minute they say, oh, I'm a transplant patient, okay, no discussion. I said, even if you want an Advantage plan, I'm not even that is not on the table here. We are talking med sup. So I think medical issues can drive the decision also.
good point. Absolutely.
That's one of the biggest points I use when it's somebody going on to Medicare is if I know that they're already on a lot of prescriptions and everything, I tell them you go on the Medicare Advantage and you won't ever be able to go to a supplement after that
Yeah.
because they're not going to qualify.
Yep. So as you guys know, you can swing it in one direction, but you can't necessarily swing it back in the other one. I always tell clients that. And going back to what I was showing you on my screen, when I show them this, I always say, you can always go from the supplement side to the Advantage side during the open enrollment period between October the 15th and December 7th of each year. You may not necessarily be able to go in the other direction.
One of the biggest things that's right now, because it's been so quick, that's helped me with it, is the problem where the biggest hospital here in Humana had a big thing where the hospital dropped Humana or Humana dropped the hospital, but people, and Humana has been my main one for Medicare Advantage, and they all talk to people. And so I found a lot of times that's the first thing they say is, well, Piedmont doesn't take Humana anymore. They do, but as far as the client knows, they don't think they do. So that's made a lot of decisions for me before I ever even get to them.
Yep. Yep. Absolutely good point. And make no mistake, Medicare Advantage plans, one of the biggest, most important aspects of them is the network. Here in the Dallas-Fort Worth area, United, Humana, and Aetna pretty much got everybody. I mean, you'd have to try to go out of the network with United or Aetna or Humana, but it doesn't work like that in every market. In different markets, there's going to be certain facilities that like some plans and not others. And it always, you're starting to see some of these health plans, consolidate with a hospital system. So keep in mind that as well. I was talking to a client out in California. And he's like, yeah, I'm thinking about enrolling in this. I forget the name of the plan. I've never heard of it. It's literally a Medicare Advantage plan in one county with a hospital system that really dominated that county. And I'm like, I've never heard of it, but if it works for you, fine with me. So absolutely keep in mind that network's crucial. Who else? Who wants to jump into this discussion? Chris Kreider, I see you're on here. You're quiet. Anything to share?
Yeah, I mean, pretty much what everybody's saying is kind of yes. I do find though, I have some like on the supplemental, if I have somebody who's paying IRMA, every once in a while, they'll not want that supplement because they're already paying so much. So when you talk about income and whether income drives it or not, that's not necessarily true. If they're already paying $500 a month, they're not picking up that supplement. They just as soon go with the Advantage plan.
Yeah, so glad you brought up IRMA, Chris. Thank you. For those of you who don't know what IRMA is, it's not my ex-wife. IRMA is what happens if you make too much money. For most people married filing jointly, if you're making over $100,000 a year in retirement, you're going to end up with some sort of IRMA assessment. However, something to keep in mind for your upper income folks. I just saw literally this week, both Democrats and Republicans have been talking about what they have to do to reform Medicare to keep it solvent. There's not a whole lot of agreement, except IRMA. Both Republicans and Democrats think that more people need to be hit with the IRMA assessment, and richer people need to even have a higher IRMA assessment. With the thinking, again, I'm just kind of making an example. Their thinking is like Warren Buffett should be paying more than $500 a month type of mentality. So if you haven't been dealing with people and their IRMA, you better learn how it works, because I think literally in the next 12 to 24 months, you're going to see a way higher percentage of people getting hit with the IRMA assessment. It's going to happen. It's going to be Joe Lunchbucket, who doesn't think of himself as rich, is going to start getting hit with it and going to get surprised. That's a good one, Chris. Who else wants to jump in? Yeah, Lynette.
Okay. Oh, I know. I have a lot of sound in the background, but I had really, really shock. I had an appointment with a really great couple. He was a retired surgeon from Michigan, living in Florida now. His daughter-in-law is an ER doctor, and his wife is sort of professional. And I had an appointment with them just to go over what they had, because they don't know what happened to their agent, and never called them this or that. So I had an appointment with him, and I didn't plan on selling them anything. I mean, because he was very, very intelligent. But what shocked me so much is they had an Advantage plan, and I could not believe my eyes. I said, "Oh my God, a doctor has an Advantage." I couldn't believe it, and it was an AARP plan. And I just happened to know there had been problems with the hospitals not, being out of network. Especially, it was a few years ago, and maybe they weren't down in Florida, but he had an episode where he used to practice. So, for him, he thought it was great, and I just had to sit and listen to him because he was a retired surgeon. He was a pretty, smart guy, but I was really shocked, how he was so gung ho on the supplement. And next year, I'm going to try to, I'm going to cross sell them. But it really shocked me that, because I know that there are doctors who do not care for Advantage plans.
There certainly are. Thank you for sharing that, Lynette. There certainly are doctors that will try to sway consumers. There are hospitals that will try to sway consumers one way or the other. Also, keep in mind that the Advantage carriers are rolling up doctors and hospitals. So I'll give you a real quick story. I was actually seeing my primary care physician, and I was talking to him about what I do, and he's like, yeah, blah, blah, blah. And he was saying, like, yeah, hey, we just got bought, and we are part of this now healthcare system. I'm like, oh, wow, that's interesting. I go, yeah, a lot of insurance companies are acquiring health systems. He goes, yeah, I've heard about that. I got buddies of mine that are getting bought out by insurance companies, and I always, man, there's no way that I would ever want to do that. I'm like, okay, didn't think much of it. So just out of curiosity, while I was waiting, I look up on my phone the company that bought him out. I guess he doesn't read very much, because the company that bought him out was Optum. And I got bad news for you, Doc. You work for United Healthcare. You just don't realize it, because United Healthcare likes keeping that a little secret. But if you work for Optum, you work for UHC. And doctors don't even know, they don't even realize that when their company gets bought by Optum, that they're now employees of United Healthcare. And that's going to continue to happen. So keep an eye out on that. It's a good one, Lynette. All right, we're running a little short on time. I don't want to keep you guys too long. any other thoughts, ideas, suggestions? This is all really a great discussion. And again, I wasn't looking for anybody to come to some conclusion like, oh, I'm only going to do this or I'm only going to do that. I just thought it would be a good discussion to kick it around and just be thinking about so what are some of the implications that you're seeing, and of course what others are seeing as well. Any other thoughts?
Andy, I just heard this, and I guess I didn't realize this, that if someone is on a lot of medications, that the Advantage plans tend to cover heavier, expensive medications better than the Part D drug plans. Have you heard that?
I don't know that I've heard that specifically. I think it's kind of back to what Bob was saying. I think it really depends. It depends on the market. I think it depends on the plans. It certainly is possible, but I think the opposite could also be possible depending on the market and the products and the carriers. So I'm not aware of anything like structurally, like foundationally, that would cause that to happen, but I absolutely know it can and does.
Yeah, I'm under the impression, to bear that out and using Silver Script and Aetna as an example, same company, the standalone prescription drug plan for Ozempic is more money than the Ozempic through an Advantage.
Yeah, there's absolutely going to be differences. I worked at Aetna, and I'm just telling you, those two divisions barely talk to each other. They barely know each other. Totally two different animals.
I
in terms of
didn't know that drugs were negotiated by the carriers throughout the year. I mean, like WellCare just dropped Novolog, and then WellCare told my client what to go to. And I thought at first it was a scam, but it's not. He had to change.
No, they absolutely can do mid-year formulary changes. They can do, and not to mention networks can change mid-year too, right? Your doctor says, yeah, I take it, and then halfway through the year, yeah, I don't take it anymore. Or the carrier kicks them out. I mean, that's really something I wish the regulators would get on instead of worrying about all the scope of appointment nonsense. Those are the kinds of things that really infuriate people, is these mid-year changes when they've already bought and they think they've got a doctor or a prescription, and now all of a sudden they don't. All right, let's finish up, guys. In the chat, I put a link to our resource library for all things Medicare. If you want a copy of the recordings of anything that we've talked about regarding Medicare, any of the tools, resources, the Medicare New Book, everything is on that site, and I'm trying to put everything I can think of that would be helpful all in one place, so that you got to keep, Google searching stuff. So if you have ideas you want me to put on there, I'm happy to do it. Please go visit that often so you get everything that you need, including recordings of previous calls. I also want to remind everybody, if you have not done so, please get registered for our agent conference coming up on July 15th and 16th. Is that right? Yeah, 15th and 16th here in Frisco, Texas. Most everybody who I see right now has been to our agent conference before. I think you're going to find this one bigger and better than ever. We got great sponsors, as I mentioned. For the first time, we are going to have a professional MC that is going to be being the host instead of me. So that's going to be great. We're going to have a lot of great speakers. We're going to have a lot of roundtable discussions like we did last year. Very interactive. Think of it like this discussion, but sitting at a table with your peers, kicking around ideas, getting everybody ready for the upcoming selling season. So you don't want to miss it. I will tell you that ticket prices are going up soon. I think the deadline is March 31st, I believe, is the deadline for early bird tickets. They go up after that. So I suggest you do it now, otherwise they go up. You also want to book your hotel room. Those are also going fast, and there's only a limited number at that rate. If you don't want to spend the money on the Omni, we have 2 backup hotels that are really inexpensive and they're walking distance, even though it's Texas summer. All right, that's the end of my agent conference pitch. Hey guys, thanks so much for joining. Hope you found this interesting, and we'll continue on next week. Bob, thanks again for fixing the problem with the link, but we have it all taken care of, and we'll see you guys next week.
All right, take care.
Take care, guys.